Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC, people able and willing to chart a new course. As my father once said, progress is a nice word, but change is its motivator, and change has its enemies. That's why we need new blood at CDC. That's also why it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest. Those are the guiding principles behind the changes at the CDC, and that is what you can expect all across our agency for the next 3 years. This morning, I got the latest numbers from CDC that 76.4% of Americans now have a chronic disease. This is stunning. When my uncle was president, it was 11%. 1950, it was 3%. Today, it's 76.4%. 8 out of 10 of our kids cannot qualify for military service. This is a national security issue. When my uncle was president, we spent $0 on chronic disease. Today, we spend $1.3 trillion. It's the biggest cause, it's increasing. And all of the arguments that Republicans and Democrats have about single-payer, Obamacare, or with the various ways to allocate the health dollars, they're all like rearranging deck chairs on the Titanic. If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
and I need to fire some of those people to make sure this doesn't happen again.
And Mr. Chairman, I'd like to put in the record today an op-ed written by Susan Monarez, who was fired by Mr. Kennedy.
Without objection.
So what we know, and Dr. Monarez, was approved by Republicans. She wrote an op-ed today in the Wall Street Journal, which I've just put in the record, and I quote her. She said, "I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric." So this is not some liberal philosopher or something. This is the CDC director who tells the Wall Street Journal, which is not exactly interested in progressive, theories and the like, that she was told to pre-approve the recommendations of a vaccine advisory panel filled with people who've publicly expressed anti-vaccine rhetoric. So my first question, Mr. Secretary, is did you, in fact, do what Director Monarez said you did, which is tell her to just go along with vaccine recommendations, even if she didn't think such recommendations aligned with scientific evidence? That is
no, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay. Let's talk now about what's coming up. because I've made it clear what I've thought about the 203 days with my colleague, Senator Alsobrooks. In 2 weeks, CDC's Advisory Committee on Immunization Practices will meet to make decisions about critical vaccines that protect us against hepatitis B, measles, and more. The committee's got a profound impact on vaccine access, but these aren't ordinary meetings. You've stacked the deck to ensure the panel bends to your views. In June, you fired all 17 committee members who are respected scientists and doctors. You replaced them with non-experts, vaccine skeptics, and conspiracy theorists. As a result, this critical advisory panel has lost scientific credibility. After years, colleagues, we spent so much time not looking at this as Democrats and Republicans, but as good science and scientific credibility. And now the American Academy of Pediatrics has warned that the committee is being politicized at the expense of children's health. American Academy of Pediatrics, you think they're lying too?
I think the American Academy of Pediatrics is gravely conflicted. They get their biggest contributors are the 4 largest vaccine makers. They run a journal, Pediatrics, which they make a lot of money on, that is completely dependent on pharmaceutical companies. So I wouldn't put a big stake in what they say that benefits pharmaceutical interests. Senator, I didn't politicize ACIP. I depoliticized it. The Congress has been investigating ACIP.
All over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong, too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American healthcare, and particularly these healthcare agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
Maybe you're listening to a selective group of people.
Well, you get me.
Yeah, and I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
I got 30 seconds. Dangerous respiratory viruses like RSV are on the agenda for the next advisory meeting. Countless parents have been awakened in the dead of night by a wheezing kid gasping for air, forced to rush their little one to the ER. There's no worse heart-wrenching fear. The RSV vaccine offers these kids protection against the worst effects of the virus. But now it looks like you're on a crusade to make infants and babies more vulnerable to the terrible illness. That's what we're doing with the COVID changes.
And please make your answer brief, Mr. Secretary.
I've said that.
The position is indefensible. I think it's possible.
Congress has been investigating that committee for 23 years because it is pervaded with conflicts of interest. What we did is we got rid of the conflicts of interest and we depoliticized it and put great scientists on it. From a very diverse group. Let me close with very pro-vaccine.
Let me close with this because, like Senator Crapo, I'm a few seconds over. I don't think, Mr. Secretary, this is about you and me. This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy. I don't see any evidence that you have any regrets about anything you've done or plans to change it. And my last comment is, I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense. Thank you, Mr. Chairman.
Do I get a reply? Or Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, we learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
I'm going to let Senator Wyden respond briefly to that, and then we're not going to go over like we just did.
Defend this committee on a bipartisan basis. Colleagues, my cabinet secretary says that we have no interest in chronic care. Mr. Secretary,
Mr. Chairman, could we have regular order, please?
We are in the process of turning around the Medicare program with the chronic care bill that Chairman Hatch, when he was chairman in this committee, put together on a bipartisan basis.
All right, we're going to proceed.
Mr. Secretary, in June, you fired every member. Mr. Secretary, Mr. Secretary, may I have my time back, Mr. Chairman? Thank you. Mr. Secretary, thank you for your attention. In June, you fired every member of the well-qualified panel that was charged with recommending vaccines to the CDC. No one in your job has ever fired every committee member all at once. That month, you told the American people that you were, quote, going to bring great people onto the ACIP panel, not anti-vaxxers. Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the inventors. As I said, Dr. Malone is one of the inventors of the mRNA vaccine, so he knows a lot more about it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? It's not true. It wasn't true when he said it, and it's not true when you said it. Secretary Kennedy, later this month, your new panel will meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine, for measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, you owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator,
the obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
how about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel. So
well, it's a panel. You just put those folks on. Far from what you said, they're people with ideas that are completely outside the mainstream.
You mean out of the pharmaceutical paradigm?
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free to...
I know you said that before. I do too.
To make their own choices.
So will they be just as free after these?
I assume they will be.
I will hold you to that, Secretary Kennedy, because this is not a podcast. It is the American people's health that's on the line here. This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology. I think it's critical for you to share the evidence that this panel will rely on. Will you give the American people 6 months or 6 weeks in advance the record that they're going to rely on to make these decisions? Will you make it transparent for the American people?
All the evidence is transparent.
Will
all
you
the
make
evidence-
it in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You
Are you
described
saying,
people
Senator,
moving the Titanic.
Senator, are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire.
You're evading the question.
No, I'm asking the questions here,
You're
Mr.
evading
Kennedy.
that question.
I'm asking the questions,
I
Mr.
asked you a
Kennedy.
question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
So in 2 weeks, vaccine experts at the CDC are going to meet to discuss childhood vaccine recommendations. Parents and physicians depend upon this guidance to make decisions and to keep kids safe. And as I said, I support vaccines. I've been hearing from many of my medical colleagues, people I've known from medical school, residency, and when I practiced medicine in Wyoming, and there are real concerns that safe, proven vaccines like measles, like hepatitis B and others could be in jeopardy. And that would put Americans at risk and reverse decades of progress. As we've seen over the last 4 years, the previous administration 4 years, when recommendations became politicized or were swayed by bias, that the public trust can be lost. So what safeguards are in place to ensure decisions are based solely on science and not politics? And how are you going to make sure doctors and parents can count on CDC guidance?
I mean, Senator, I would point this out. Right now, there's only 10% of children are complying with the CDC's recommendation on COVID boosters. Only 15% of healthcare workers. So Americans have lost faith in CDC, and we need to restore that faith. And we're going to do that by telling the truth and not through propaganda, by making them understand that everything that we say is true, that we're going to tell them what we know, we're going to tell them what we don't know, and we're going to tell them what we're researching and how we're doing it, and we're going to be transparent. It's the only way to restore trust in the agency, by making it trustworthy. Medicaid will still pay for them.
Of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were
witnesses. And let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you are putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
Just want to pick up on Senator Warren's point. Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no.
Wow.
Giving a quote. And I asked her twice.
No, 1 second. And you're also repeating now that she is a liar, correct? what she wrote in the Wall Street Journal?
If she wrote that I fired her because she refused to sign on in advance for the ASIP committee, no, that's not accurate.
All right, so you're calling her a liar, and I look forward to her coming before the Help Committee, maybe this committee as well.
I'm not a doctor. I'm not a trial lawyer. I'm a boring management consultant. Another question that we'll submit in the record, I'll give you directionally where we're going. I don't see how you go over 4 weeks from a public health expert with unimpeachable scientific credentials, a longtime champion of MAHA values, caring and compassionate and brilliant microbiologist, and 4 weeks later, fire her because at least the public reports say because she refused to fire people that work for her. So as somebody who advised executives on hiring strategies, number one, I would suggest in the interview, you ask them if they're truthful rather than 4 weeks after we took the time of the U.S. Senate to confirm the person just for the future nominee that we're going to have to consider. But I do also believe that some of your statements seem to contradict what you said in the prior hearing. You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that, and I'm sure that you will have some. You will do nothing that makes it difficult or discourages people from taking vaccines. There seem to be several reports that would seem to refute that, but I'd rather you just respond to it. I'm not going to come here and impose my belief over any of yours. That, again, seems to be contradictory to the firing of a CDC director, the canceling of mRNA research contracts, firing advisory board members, attempting to stall NIH funding, eliminating funding for the $500 million for further mRNA research, and just want an answer for it.
Secretary Kennedy, Dr. Daskalakis, who recently resigned as director of the National Center for Immunization and Respiratory Diseases, his resignation letter stated he and his team were never allowed to brief you. I'm curious who you're listening to, since it's clear you're not listening to qualified experts like Dr. Daskalakis. Can you give the committee the name of the person?
I don't consider Dr. Daskalakis.
Mr. Secretary, the question that I have for you is, can you give the committee a name of who you're getting briefed by?
I'm getting briefed by all the time by CDC.
Just a name.
Well, Dr. William Thompson's one name.
Thank you very much, sir. Now,
but I can get you a whole list of others. It's on my schedule.
Mr. Secretary, that's not a hard question. You know a lot of answers.
I'm not being evasive.
Okay, then you answered it. Let's go on. Now, you said that you're soon going to release a study claiming to reveal the cause of autism, timed unsurprisingly with the upcoming ASIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children, so I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
He's a contractor?
He's a contractor.
Do you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what.
I'm going to pull up the website for you.
He's a contractor.
If the website says he is a senior data analyst, will you at least admit to the committee
I don't know if
wrong?
a contractor can be classified as a senior data analyst or not.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board, he sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot. It's incredible, Mr. Kennedy.
Senator, you're ridiculous.
So here's the question I have. You brought him in to do this study. I think there's no question about it.
I told you he's not doing a study.
Is he participating in the study?
No.
Is he doing any analysis in regards to this study?
No. What he's doing is getting access the Vaccine Safety Data Link, which is the biggest repository for vaccine information that your friend would not give us for 7 months. For
Mr.
7 months.
Secretary, let me ask you this question, just because you know the answer. What is Mr. Geyer doing?
He is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So because CDC will not give us, they have
Mr. Secretary, is he participating in this then?
No, he is.
But you just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator, or do you just want to show? Do you just want to showboat?
I'll submit
You
this.
just want to showboat for your ads, or do you want to hear a real answer to your question?
Mr. Secretary, you choose to know answers to questions with some colleagues. And
I'm willing to give you the answer. I'm willing to give you the answer.
Mr. Secretary, someone should have asked you, maybe President Trump should have asked you, are you a trustworthy person? And we should have waited for an answer then. Let's move on.
I don't even know what you're talking about. You're talking gibberish.
Mr. Secretary, let me speak slowly and clearly so that you can understand me through my New Mexico accent.
And then give me a chance to answer.
Does this help? Can you understand me?
Yes.
Appreciate that. Mr. Secretary, yes or no, did you hire Mr. Geyer to do this study?
No.
Less than a month ago, we received the heartbreaking news that a gunman opened fire at the CDC campus in Atlanta, Georgia. This obviously is my neck of the woods. This is heart-wrenching for all Americans, but for those of us especially who live in that area. A DeKalb County police officer, David Rose, was killed. The shots hit buildings on campus in at least 180 places, narrowly missing the CDC's daycare center. Law enforcement recovered nearly 500 shell casings. Clearly, he came to do a lot of damage. It's a miracle, and thanks to the quick action of Metro Atlanta and state law enforcement, more people were not killed. The Georgia Bureau of Investigation announced that prior to the attack, the gunman expressed discontent with the COVID vaccine and, quote, wanted to make the public aware of his distrust of the vaccines. Secretary Kennedy, I assume you are aware of these disturbing reports of the gunman's motives?
Yes.
And, I understand that some people may have concerns about new medical breakthroughs, but those people don't have the world's top medical experts working under them. You've been over HHS for 7 months now. Have you ever been briefed by CDC's career immunization officials to discuss your concerns?
And by the way, every member of this panel has criticized President Trump and demonized him.
Have you ever
Are
been
you
briefed?
complicit in the assassination attempts on President Trump?
Sir, I'm asking the questions. You are the witness. It's a simple yes or no question. Have you ever been briefed by CDC's career immunization officials to discuss their concerns?
Yes, I have.
What was the answer?
Yes.
You have been briefed by CDC officials, the career immunization officials, to express your...
The senior vaccine safety scientist, for example.
Have you ever been to the CDC as secretary before the shooting on August 8th?
Have I ever been there as secretary?
Have you been there as secretary before the shooting?
No.
Okay. Let's return to the shooting and the aftermath. Secretary Kennedy, I'm about to ask you a series of yes or no questions about the events of the past month, and I would appreciate just a yes or no response. You called Dr. Menarez to your office on August 25th for a meeting. Is that correct? Yes or no?
It could be. I just don't know the date. I'd have to check my calendar.
Was Jim O'Neill the man you just appointed as acting director of CDC in the room on whatever date you met with him, since you can't recall? Was he in the room when you met with Dr. Menarez? In that meeting, did you criticize Dr. Menarez for her statements to CDC following the shooting where she said, quote, misinformation can be dangerous?
I don't believe so. I have no recollection.
You don't believe you criticized her?
Oh, I criticized her.
Did you criticize
Not
her
for that.
did you criticize her?
I don't even.
Did you
I don't know
criticize her
anything
for her
about that
statements
statement.
to CDC workers following the shooting?
Did I what?
Did you demand that she fire career scientists or public experts at the CDC?
Yes.
Did you demand that she accept the recommendations of your hand-picked vaccine advisory panel without further review by career CDC scientists?
No, I did not.
You didn't ask for her commitment ahead of time that she would accept the recommendations from the advisory panel. You're
No,
denying
what
that?
I asked her about is she had made a statement that she was going to not sign on, and I wanted clarification about that.
Did you tell her to accept the advisory panel's recommendations?
I told her I didn't want her to have a rule that she's not going to sign on to it.
Did you say that the CDC was, quote, the most corrupt federal agency in the history of the world?
Not the history of the world, but definitely within HHS.
Did you say that?
I did not say that, but I did say it's the most corrupt agency in HHS, and maybe the government.
So you called the CDC corrupt. Did you say that CDC staff are, quote, horrible people?
Horrible people?
Did you say that they're killing children and they don't care?
No.
Okay, I think that we all have a history of listening to you and these answers, but you're on the record for a number of these statements. Despite your lack of credentials and expertise, clearly you have an agenda. It is a threat to the public health of the American people. It's clear that you are carrying out your extremist beliefs, which is why you attempted to fire Dr.
Senator, we're the
Menarez.
sickest people in the world.
Sir, I'm not.
We're the sickest people on earth.
I'm speaking.
How am I a threat?
Secretary Kennedy, for the first time, we're seeing deaths from children from measles. We haven't seen that in 2 decades. We're seeing that under your watch. You are a hazard to the health of the American people.
Can I respond to that, Senator?
No, I claim back my time.
We need to wrap
You are
up.
a hazard to the health of the American people. I think that you ought to resign. And if you don't resign, the President of the United States, who put forward Operation Warp Speed, which worked, should fire you. Thank you so much.